All right, everyone, it's now 2 p.m., so I'm going to begin the webinar. If you don't right now, please make sure that you have the GoToWebinar viewer in the foreground that is on top of all of your other screens. It should be sharing the Home Care Institute homepage. This should look basically like your homepage, except for perhaps with a different banner here. So you should be able to see my screen. To start off with, I just want to go over a few housekeeping things. So firstly, don't worry, everyone is muted. I intend to keep everyone muted for this session simply because we do have so many attendees today for this webinar. If you have any questions, I encourage you to enter those questions into the chat, but be advised the chat, unless you specify your message only to me, the chat will be visible to everyone, so all of the other attendees in the webinar as well. There's no problem with that, just for everyone to be aware. If you look in the chat now, you'll see that I've already posted a message. That is that please post your questions in the chat. We will have a recording of today's session available tomorrow, and I'll send out a link to everyone just the same way that I sent out the invitation to this session. Also, at the end of the webinar is when I will go through and look at those questions. Since we do have a fair amount of ground to cover and I want to make sure to be respectful of everyone's time, I'll save those questions until the end. But don't be shy. Once it becomes question and answer time, I'm happy to answer any questions you might have, not only about what we're covering today, but also if you have other questions about administrator tools, that would be great for the end session. Hopefully we will cover all of our intended material for today, that is reporting and a few other common administrator tools in the first hour. So hopefully we'll be ready to take a short break at around 3 p.m. Eastern. So we'll take about a 10 or 15 minute break at that time, and when we come back is when we'll do the question and answer section. So if anyone isn't able to stick around for the question and answer, hopefully you'll get all of the information you need before then. All right, so let's begin. So we're here on the home page, and I want to start off right out the gate with some reports. So we're going to go in order of our simplest to our more complex reports. Hopefully the majority of people here are already familiar with our reports page. You can get here from the home page. I just scrolled down, and on the right-hand side I have links to the reports page. Or if you have a drop-down menu here, you can go to reports. This will take you to the exact same page. If you do not have a drop-down menu on your home page, that's a good indicator that you're not a site administrator. So if you are here on this call today and you're not a site administrator, that's fine, but a lot of what we do today, you're going to need to change your role to a site administrator in order to use these tools. So not a problem, it can be done, and just so you know, organizations can have as many site administrators as necessary. All that is a role that indicates that you have access to everyone in your organization. So let's go to the reports page. On this page, we have on the left-hand side knowledge delivery, which are mostly course-based. These are looking at individual courses, or rather looking at training course by course. On the right-hand side, we have knowledge programs. So if you're using a knowledge program, one of our groups of courses, or a custom group of courses, to assign training automatically, then these knowledge program reports are incredibly useful. Let's start on the left-hand side, the knowledge delivery side, and look at the employee training report. The employee training report is an extremely helpful report. The only downside is we do have some limitations in what we can and cannot do here. So we can limit our training, our results, by date range. You've probably noticed, if you've been in here so far this month, that as of January 1st, the date range automatically reset to show January and just 1 month. It's meant to show this calendar year so far. So if we want to include last year's training, we're going to want to change this. So we're going to want to start our training in January 2018, and we're going to want to get the entire year of 2018. So here is the first bit of an issue that we've seen many of our clients run into the past couple of weeks. And that is that you might logically think they're going to put in 12 months, the 12 months after January 1st, or January 2018, getting you all of the year of 2018. And that's what you'll get. However, the that means that your report will not accurately reflect any training that was assigned in 2018, but completed technically in 2019. So if you have any staff that may have completed their training a few days late, which is a lot of us, then it's a good idea to extend that through this month. So instead of putting 12 months, go ahead and do 13. That will get you all of the training. So when you're doing those date ranges, just keep in mind not to cut off training that may have been completed late. Now these reports by default are going to get all of our employees who are active. If you want to see all of last year's training and some of your staff who may have left, go ahead and switch this to all. That will get you all of your staff, whether they were active or not at this current time. And of course, we can look at it as a PDF or a comma-separated value. The PDF file, if you're using Google Chrome, which is what I am using for this demonstration today, will preview here in this large open space. And to get this, I just clicked the search button in the top right-hand corner. Anytime I change my filters on the left-hand side, I can get a new version of my report by clicking search. So this is a PDF. It has a lot more formatting. The benefit of this and of using the PDF version of the report in the employee training report is that it automatically page breaks between users. This is excellent for something that you need to print off and have on hand for looking at the training for a single user. The downside is I cannot control whether or not this report includes completed training or just enrolled training. It's going to give me everything. So that's the downside of this report. It's going to give me all of the training, whether it's completed or not, within the date range that I specify. So here we see my little test account, and we see that she has a lot of training that was completed. In fact, you can see just before this session, I manually moved a lot of her 2017 training to completed so it wouldn't continue to show on her transcript. I can also use comma-separated values, which you might be more familiar with as a .csv file. This is going to be a file that we can open in Excel. The reports page is the only place that you can produce a PDF report, unless you're including printing certificates. Certificates will always be exported as a PDF. Everywhere else on the site, when you're running a training report, a transcript report, you're not going to have the option to choose that pretty PDF file that already has the page breaks and the formatting. You're going to get this .csv file, which by virtue of being a .csv file, doesn't have any formatting. On the bright side, it's very easy to go in here and edit anything that you need to make your own formatting here and to make changes to what you actually include in this report. So there I quickly got rid of some columns that I knew I didn't need, and I was able to streamline this report a little bit. But as I said, it doesn't have those page breaks. It doesn't really have any formatting, so you do have to take that extra step on your own to make it look a little bit nicer. And that is something that if we have time after our question and answer, I'd be happy to go over some of the formatting options for making your CSV print a little bit better. And that's the basic gist of these reports. The benefit of using a report from the report page is that you don't have to do a lot of work to get a lot of data. So I do recommend on the left-hand side, the employee training report is probably the most useful of these reports. Anywhere that you see the word completion, you should know that this is completion on a business unit level. So if I just very quickly hit search, just so I can give you guys an example of what is included in this report. And these reports do take a moment. If you aren't familiar with, you can move away from the page where you're running the report, and when it's done, you will get a pop-up here inside of HCI just alerting you that your report is finished. So you can continue to work on other things. So this completion report, for every course that someone in my organization is enrolled in, I can see what number of people have completed it. So that's what I mean by at an organizational level. It's showing me overall what is our compliance level on our training. But it's not telling me who that is. Nowhere on this report is it going to list which users have and have not completed this training. So this report may not be quite what you wish it was. Now on the right-hand side, my recommendation is to use the Employee Knowledge Program Detailed Report. Completions is going to give us something similar to what we just saw in course completions, but a knowledge program level. So it's going to tell you the number of users and the percentage of users who have completed their knowledge programs, but it won't tell you who that is. The summary report is going to go user by user, but it's not going to show the courses inside of the knowledge program. It will show you the number of courses. So say you have 15 courses in your knowledge program. It will show you that 7 are completed and 8 are not completed, but you won't know which ones. So if you want the most detailed view of your knowledge program compliance, you're going to want to use the Knowledge Program Details Report. This report I'm simply going to run as a PDF, just because we don't need to go into too much detail here. Again, we see that it is set to be this calendar year so far. All employees who are active, and I do have my choice of PDF or comma separated value. Here I also have the ability to pick the particular knowledge program. And I didn't linger on this too much, but I do have the ability to filter by business unit. So just as I could go into employee and search for a single or a group of employees to include on this report, that is, I could limit it, I could also limit by business unit. So if you only need to run a report on a subsection of your business unit, you can go into here, and if you have an arrow to expand your business unit, you can select any of these options. It may be the case that you do not have any subdivisions of your business unit, in which case those would have to be built externally before you could do this. So if you are wishing that you had those subdivisions, just contact support about splitting up your organization on the website, and we can talk to you about how that actually works. Now looking at the program report. So here again we see it is by user. We see the name of the specific knowledge program, and we see all of the courses inside it, whether they're completed, the date, and any grades. Now these courses were all given manual credit, so there is no grade. Normally the grade would be listed there. It jumps to the next knowledge program, same information, and then a page break before a new user. The CSV file would look very similar to the other CSV report we saw. And it does organize by user. There simply is no formatting in between users. So those are our simplest reports. They're a great place to start and a great place to start getting familiar with the way that our filters work. However, even the filters are simplistic. Much of the training reports that you need, you may actually want to use a different page. So now we're going to take a look at the Training Transcript Manager. Now certainly a lot of what we do here can be done by making changes to a report from the reports page. For example, once I have this CSV version of the employee training report, if I don't want all of this information, say I don't need any courses that are completed, I just want to know which courses remain to be completed, I could remove those. But I can't add anything to this report that's not already there. So if there's some column that is not captured in this report, that's really the time I need to move over and use the Transcript Manager. Now again, I just went to the menu, Training, Transcript Manager. And you can do that from any page. The menu bar will still be available. So that's how we get into the Transcript Manager page. The Transcript Manager page has access to a lot of information and a lot of different tools. I want to start out by saying that where we see these edit and delete buttons, you want to exercise extreme caution. These are editing and deleting transcript information at the highest level, meaning there is no undo button for you, and there's no undo button for us at support either. So please be extremely careful when making changes to transcripts. Just so you know, I'm going to load in everything quickly. If you do go and accidentally click on the delete button, you have exactly one opportunity to change your mind. So if you see this pop-up window and you did not intend to delete a transcript, make sure you don't click through it too quickly, and you do select no if that is a mistake. The only time you might want to delete a transcript would be if it was assigned in error, and you no longer want that transcript information to show on any of your reports. All right, so let's look at some of the filters we have here. It is a lot more filters than on our reports page, but we don't have to use them. One of the key differences, however, is that there is no date range by default. So if you go to hit search, just like all of the searches on Home Care Institute, it's going to attempt to give you as much information as possible. In this case, all courses, all sessions, all users who are active. So again, if I want to include inactive users, I need to switch that to all statuses, all types, all topics. It's really not limiting anything. It's trying to give you as much transcript information as possible. For some of our clients who have a lot of users or have been with us for several years, you may actually not be able to see all of your training at once. You'll know if this is the case because when you hit search, you're going to get a warning here that tells you that you have a certain number of results. You may get a warning that states that your results may cause the system to run slower, but it gives you the option to try it again. And you're welcome to do so. You can, without changing anything, hit search a second time and it may let you run it through. However, you may also get a warning that says that you just have too many results. And our numbers on that are increasing all the time. So again, this may not affect all users, but just be aware that you may attempt to run a search here that simply returns too many results. If that's the case, we recommend limiting your search, most likely by date range. So you can do it a single year at a time, or you might be lucky and be able to do it a couple of years at a time. In worst case scenario, you may have to go month by month. Alternatively, you could search by groups of users. It's up to you if you do need to split your search into multiple batches, how you want to do that. So in this case, let's take a look at some of our most common options. So if we wanted to look at certain courses, I'm going to click on, very simply here, I clicked on the down arrow. This opens up the search box. So this is our course lookup. Again, if I just hit search, it's going to give me everything. Or I can search in here, and let's look up body mechanics. So let's make our search today to see about training that users have done on 2018 body mechanics. Now, this is not a course that has sessions. This option was already selected when I got here. It is the all employees I can see that do not report to me. That should always be selected. It has the option to deselect it in case you only want to see those users for whom you are listed as the direct manager, because that's what this does. This checked box allows you to see everyone in your organization. If I uncheck it, I'm going to no longer be able to see the majority of these users. So just keep it checked in order to see your entire organization. Job classifications. I could search by job classification or by business unit. Usually, if I'm going to search for only certain users, I prefer to still do this inside of the employee search. In here, I still have those same options. I can still search by job classification or business unit. The difference being that if I search for business unit here and say I'm only interested in really my clinical staff, or at least not my administrative staff. Now I can see exactly who's going to be included in that before I run my report. So if I'm not seeing a name that I expect to see, or I'm seeing some names that I didn't expect, I know that right away. Select those users. So now I can see I have 17 selections. You can also search by the status. So these advanced search options, now we're looking at options for the transcript itself. So let's say we want to look at anything that's not withdraw requested or withdrawn. So this is going to give us whether it's enrolled, whether it's completed. We're going to get all of that. So if you wanted to simply see completed courses, this is where you could select that. If you wanted to see everything that's not completed, it's a common one for me, I'll just deselect the one that I don't want to see. In this case, we're just going to ignore withdraws. Now in this case, I know that I don't need to use a date range because I have specifically selected a 2018 course. So I know that those are going to be things that are basically assigned in 2018. But let's take a look at the date ranges just in case. And in fact, selecting the course may be more useful to you than using the date range because you're not going to have to worry about what we saw earlier with accidentally using an end date that's too soon. Another way to get around the end date issue is to not sort by end date, to sort instead by the start date. The start date here being not the date that the course is started by the user, but the date that it's actually assigned. So if you're looking for training that is assigned in 2018, could very simply go into here. I'm just going to cancel out of here because I want you to see what I did. I clicked on the name where it says January 2019, and that allows me to quickly jump in years or months. As we're now in January 2019, very useful rather than having to click the left arrow 11 or 12 times. So let's go for anything that was assigned starting in January 1st, 2018 to the end of 2018. Could also search by end date. Now that is going to exclude anything that doesn't have an end date, so anything that is not completed. Our search, we want to see enrolled courses, so that's not a good option for us. Using an end date that is before today is also going to exclude anything that was completed after that end date, or perhaps give you an incomplete picture. Due date is an excellent way to search. So if you're looking for courses that were due or previously, so anything that's past due, you can search by the due date. Of course, you can search by type and topic, but I'm just going to scroll up, and to refresh the right-hand side, now that I've changed my filters again, I need to hit search. So just a reminder, every time you update your filters on the left-hand side, go up and hit search to refresh your results. So now I'm only getting bottom mechanics. And it's only the certain staff. Now I have my options. I don't need to assign anything to these users. I'm looking at this. I'm trying to create a report. I don't want to edit it, and I certainly don't want to delete it. What I want to do is I want to go into my actions. And you have a lot of actions here. But in order to run our report, we want to export. Now we have 3 different export options. Export plain is going to be your general reporting option to create a CSV file. Export as crosstab is going to give you a large file with way more columns than what you probably want, and you would have to go through them and eliminate things that you don't actually want to include in your report. Export package course data is going to export a zip file with multiple sheets in it, multiple CSV files, relating to all of the back-end data, such as which questions users answered, how long they spent answering each question on each page. So really granular back-end data is in that packaged course data. For our general reports, we'll just want to export. Now I've been on here before, and so it remembers some of the columns that I like to include. If you've never used this export option to create a report, you might be a little confused by the order of the items here on this list. There is an order to them. It starts with employee items, moving on to business unit items, moving on to course information. That is the kind of thing that you would find in the training catalog. Finally, session information, which if you're not familiar with what a session is, you probably don't need to include the session information. We can go more into that in the Q&A if anyone has any questions. But generally speaking, there is no session information for the majority of courses. And then finally, towards the end, we get the transcript information. So that is the information about the individual enrollment, such as start date, end date, due date. And at the very bottom, we even have credits. That is the credit hours. Now, if you don't like this order, that's perfectly fine. Instead, what we can do is, when we go to export, click where it says value, and now this is sorted alphabetically. So there's no need to memorize the somewhat logical order that this list comes in. You can sort it into alphabetical order in order to find the columns that you want. So here we're using course, credits, that is credit hours, the due date, end date, first name, grade, last name, and I believe, oh yes, start date. And that's all that we're using in this particular report. And I just click Download Exported Values. I have 14 records that will be included in this report. And there we go. Here's my Transcript Manager report. So it's much cleaner, much less extraneous information than our reports page report CSV. However, I did have to do a lot more work. On the bright side, it's very customizable. So I have full control here, but full control also means full responsibility. If I wanted to make a change, say I realized, oh, I have start date, end date, due date, and grade, maybe I want a little more information about this user. I still have my search results here. I can simply go back into Action Export. It does still have these items selected. However, they're back into their original order. So maybe I want to include some information about this user. Maybe I want to know who their reporting manager is. I just hit download again. I'm going to get a new version of the report that has who they report to. So now I know that if I need to send this information along to their manager, I know who that is. Also on this page under Action was Print Certificates. Now, not all of these are completed, but I do know that I only have 14 records, so that's easily going to be done in one batch. And again, this is the only thing other than the reports page reports that will give me a PDF. So if you're finding that you need to print a lot of certificates from last year, you can do that from this page as well. It will limit you to batches of roughly 30. After you hit the 30 limit, you're going to have to pare down your search. So you may have to do it month by month. In some particularly busy months, you may even have to go week by week. Just depends on your staff and how much training was completed at a time. And that's reporting from the Transcript Manager. This really is the most complex place to run reports. However, it is also the most comprehensive. There's really no report that you need that you can't get from here. The one thing I will say is that from this Transcript Manager page, you can't tell whether a given course was a part of a knowledge program or not. And that's really the drawback of using either this page or, if we go to Menu, Training, Knowledge Program Manager, this page. Now on this page, it looks very similar to the Transcript Manager, except for that we don't have as much course information. We can select a knowledge program, and then I have all my same employee search, and a few different advanced search options, the status of the program, its start and end date, expected completion, which here is the same as a due date. I could filter by any of those. But when I go to Action and I go to create my report, I don't have anything for the course name. All I have here under C is credits. And here the credit is not referring to credit hours. The credits here, credits received, remaining, and required, is actually referring to the courses inside of the knowledge program. As you can tell by the fact that there's no name option, it's actually just going to give me numbers. So much like the summary the Knowledge Program Summary Report on the Reports page, is going to tell me of the assigned courses, how many are completed, remaining, or were required in the first place. But it's not going to tell me which ones. So really, if you are looking to run a report on training from a knowledge program level and you're wanting to know which courses are a part of a knowledge program, then your best option is still on the reports page, the knowledge program detail report. Now, of course, this report is only going to pull courses that are a part of a knowledge program. So it's going to exclude anything that was assigned manually outside of a knowledge program. So if you want those courses, you're going to have to run another report. There is no way currently to run a report for training that was assigned manually. So you can either run a report for all training or for just a knowledge program, but not just for manually assigned training, unless you happen to know which courses are manually assigned, in which case anywhere that you're running reports from a course level, whether that is the employee training page, or I suppose not that, or the Transcript Manager, you can use filters where they're available. So here I used body mechanics on your Transcript Manager or on your employee training. You could always use your filters inside of Excel to focus in on specific courses if you happen to know that those ones were manually assigned. Now that was from the Transcript Manager. I want to go back here. So in addition to being able to export these to create your report, you can also click in on any of these transcript files. And this is an editable page, so you want to exercise caution here, not to change anything that you don't intend to change. But if you do have any questions about something that's on a report, you can always go right back to the page where you searched for it and look at all of the tabs for its details. So here, for example, I can see the status history. This is the kind of information that would be on that package detail report, or the, what's the terminology here? The package course data. So this kind of information would be on the package course data. This is actually, if we click into here, so this is only 3 seconds, so it hasn't caught much. This is, on this page, you're actually just going to see the JSON. We're just going to see basically encrypted data, but all of the data that incurs, so things like started, launches, is also part of that package data. And in the package data export, it is readable. Just since I've been talking about it, let's go ahead and, oh, I have to select things. And now I've upset it. If this happens, hopefully you can just do a quick refresh search. Worst case scenario, I have to close out of here and come back. Just quickly. Oh, wrong course. All right, that seems to be protesting right now, and I don't want to log out in the middle of our administrator training session to log back in. So we're just going to move away. That was the last thing I wanted to show you, was just that, but I'm sure I have a saved version of it. For during our Q&A session. So if anyone would like to see that during the Q&A session, just feel free to ask. For the time being, we're at 2:34, so we're doing pretty well. I do want to take a look, because I do know some of us use this feature. I want to take a look at some of the manager training items and take a look at how they're different. So for example, the team training. The team training page is roughly analogous to the Transcript Manager page that we've been on. The difference being that when we first get here, it's going to give us a graphic view. We're going to want to scroll down and switch instead to the list view. And also on the left-hand side, we still have this option for all employees I can see that do not report to me, but it's not checked by default. So as site administrators, you are going to want to check that in order to see everyone in your organization. Now, if at any time, whether you're here, you're on the Transcript Manager page or another report page, if you find you're having difficulty seeing any of your employees in your searches, you're going to want to contact support. It is possible that sometimes organizations can be set up a little bit oddly, or a user's setup might be a little bit strange. And so if you do have a situation where you're having trouble seeing your user, we're just going to want to go through everything and make sure everyone is set up correctly and that your permissions are set up correctly. All right. So here we have very similar to their page we were just on, but it does have a date range by default. So it does, like our reports pages, have this calendar year so far. So if we wanted to see last year's training, again, we're going to want to switch it to January 2018 and 13 months. We can select by course, very similar to the Transcript Manager page. And we can select by some attributes of our employees, including whether or not they're active. Or go into the employee search again, exact same window as before. And we do have a few advanced search options. Not nearly as many as we had on the Transcript Manager, but we can still search by status and by due date. So what we don't have is we don't have the start date, we don't have the end date, and we don't have a few of the other little options that we didn't go into. So just to go back to compare, here we also had status date, so date of the status change, type, topic, credit, has a transcript document. Those are the kinds of things that aren't available on this page, but the majority of what you really want is. So this is a perfectly useful page. Just hit search refresh to make sure all my filters are being used. And here, just like our Transcript Manager page, we do have an action button. And we do have the ability to export. Now we do not have a new, an edit, or a delete button here because this is meant to be used by managers who have less control over transcripts in general. But we can export, and we have most of the same options. I say most instead of all because, sorting this into alphabetical order and looking at our C's, you'll notice that we do not have the credit option. In fact, the only place you can reliably include credit hours on a report is the Transcript Manager. So that's part of the reason why that's really what I wanted to focus on today's session. And I highly encourage you, if you are not currently using the Transcript Manager, to really focus in on that and make sure that you have a full understanding of that by the end of today's webinar as much as possible, or at least a working understanding of it, since it does have a lot of options that some of the other reports do not. Credits there being one of the big ones. That said, I do have plenty of options here. I can still get the basic transcript information, start date, end date, grade, all the user information, first name, last name, their report to. So let's download these. I have a lot more records included this time because I just got all of the training from 2018 going into this month. And we see it looks basically the same as the report we were looking at before. In fact, it's very similar to the report that we ran at the beginning of this session when we did the employee training report, because I chose not to use a lot of the filters. If I had chosen to look at only completed training, then that would be a good reason to use this team training manager or team training activity page rather than using a reports page report, since I can search by status. Another option we have here under action is a quick row count. Row count might not be necessary when you're running reports, but if you are doing those print certificates, it's a good idea to know how many results you're getting. So this is all of the completed training for 2018. If I wanted to get all of the certificates for this training, I know I'm going to have to break this down into basically 11 sections. So that gives me a good indicator that if I went month by month, I could probably do this that way. So that's just, again, action row count, so you can get a gauge of how many results you have for your search. All right, now I want to step away from reports for a minute, although that is, as I said, the focus of today's session. I want to make sure that everyone has a clear understanding of a little bit of troubleshooting and user management. I also want to look briefly at enrollment. So if you're not aware of manual enrollments, you can, of course, make them from the training catalog. Go in here, search for the course that you wish to assign. These 2018 courses will be retired quite soon. So make sure you have everybody switched over to the 2019 versions. Everyone has the Enroll Me button, but you site administrators also have the Enroll Team Members button. So this page has the three things that you really need for an enrollment, which is what we are assigning, who we are assigning, and when we are expecting it to be due. Who, what, and when. And those are really the three things anytime you're looking to make an assignment that you need to decide ahead of time. Who, what, and when. So it doesn't matter whether you're making a manual assignment yourself on the page, whether you're trying to decide on a knowledge program, or whether you're communicating with support about making an assignment. The three things that need to be decided ahead of time are who is getting this training, what is the training, and when is it due, if it is due at a certain time. You're not required to use a due date. It is always optional. So here, by using the training catalog, I've already selected my course. I can go and select employees, and if I search by name, it gives me a very familiar window. That's another reason I recommend that as you're running these searches and you are filtering users, I do recommend going by name because you can simply learn to use this one screen, and you never have to worry about the peculiarities of each particular search. You can just sort of learn one box and use it everywhere. So here I can select one user or multiple users. And my due date. Going to be generous here and give to the end of the year. Enroll Now. Now the benefit of these manual enrollments, as for example from the training catalog, is that they are automatic. I happen to know that my test account admin was already enrolled in this course, but if she had not been, I would expect she would be able to simply refresh her page and see that it was in her My Training. Now the training catalog is limited in that you can only assign one course at a time. You can assign it to multiple users, as we saw, but not multiple courses at a time. If we go back to the team training, which is that manager tool that we were looking at for running reports, go to the list view and go to its action button, we see there is an Enroll Team Members option. This is one place that you can make assignments to multiple courses at a time. So again, it has those three pieces of information: the who, the what, and the when. Now though, when I go into the search, this course lookup looks more similar to when we are looking up courses to run a report. And I could select multiple training options here. I do want to point out, so I've selected 2 courses. If I want to select multiple courses and I want to use the search function, I can select some courses, go in, search for more, and continue to add them in without getting rid of the course I've already selected. So I can keep going back in without accidentally deleting anything. However, if I change my mind, I certainly can choose to remove things. It's the same with employees. I could go in here and search for a particular employee, and I could go back in and search for others. Now is a good time to point out, if you haven't used the search tools in a while, that our name search is last name, comma, first name. So my test account is Ann Admin. If I try to type her name in full, Ann Admin, I won't get any results. However, typing any portion of her name or her name in last name, comma, first name order, I will get her as a result. And of course, due date. This time I'm going to be a little more strict, just a few months to complete these courses because I want them done quickly. And I would enroll now. So that's one place, that's the team training activity. And then once we get it into this view, that is the list view, and we get to our action button, we can use the enroll team members. We also have this, if we go back to our Transcript Manager, this new button. And when I click on this new button, I think you'll see why I've saved this particular function for last, even though we were on this page first. When I go in here to create transcripts, I have a lot of options. However, all I need to put in here is the exact same information that I've put in everywhere else. Who, the employees, what, the courses, and then when, the due date. The rest of these options can be left blank if you're just making an assignment. The reason you have more options is because technically you have the ability to create a full transcript, that is, completed training transcript, here on this page. But if all we want to do is make an enrollment, we can do that very simply by just selecting those same three things that we always do. Don't need to put anything else in, just create the transcript. So simplest is the training catalog, but it does only allow you to assign one course at a time. Moving up a level, we have the team training activity, which again I got to from the bottom of your home page here. And we have the option to enroll multiple people in multiple courses. Going a step further, we can do the same thing from the Transcript Manager, new, create transcripts. However, we just have to be careful because there are a lot of additional options doing this from the Transcript Manager. The drawback of all of these is that much like a knowledge program, because they're being bulk assigned at once, I can only select one due date. That is, it doesn't matter whether I am assigning 3 courses or 13. If I'm doing it at one time, they're all going to have the same due date. If I wanted to have different due dates for the courses I'm assigning, I'm still going to have to do that in separate functions. So I'm still going to have to go in for either each course, if each course has a different due date, or each batch that has a different due date. Now I want to say a word, because it is still January, about knowledge programs. Hopefully, most of you already have your 2019 knowledge program set up. If you don't have a 2019 knowledge program set up, it is not too late to contact support. And now, a knowledge program is, of course, our groups of training. Lots of our clients use it for annual compliance. Some of our clients use it for job-specific or orientation training. It doesn't have to be so formal. It can be quite simple. So if you have a group of 4 courses that are a particular task related, you could group those into a knowledge program and have those assigned to the users who need it most. So if you had a group of aid courses that you know you want assigned to all of your aides, we could create that as a knowledge program for you as well. It can really get specific. These can be assigned to as large a group as your entire organization, or as small a group as people of a particular job classification, such as HHRN, we see here. These can have due dates such as the end of the calendar year, a specific date, or 1 month after assignment, which can be particularly useful in the case of orientation. So if you're thinking about the number of courses you have to assign, and right now it feels a little bit overwhelming and time-consuming, Consider whether or not any of those assignments could be created as a knowledge program that would then be automatically assigned. If you're interested in creating a knowledge program with us, all you need to tell us is, again, those 3 key things. What is the training, who needs to get it, and when is it due? Using those 3 pieces of information, we can create a knowledge program for you that which will hopefully take some of the work away of going in and manually assigning courses. I do want to point out as well here on the home page, in addition to our training catalog reports, we also have the Contact HCI support page. If you're not familiar with our ticket system, you don't have to be logged in to use it. I encourage everyone to bookmark this particular page, hciclient.com/support, since you can access it at any time without logging in. It's a great place if you have a quick message you need to send to support. You can always submit a ticket. We also have our knowledge base, which is basically a how-to use Home Care Institute. This includes things like, I miss administrator training. Is there a recording? Yes, there is. So there's a recording of a previous administrator training. Down to things that'll help users. How can I change my browser? Or some of the things that we've covered here today. For example, if I search for report, how do I run a report from the Transcript Manager? Now this one doesn't have a video, but it does have a job aid with step-by-step instructions, including screenshots that explain every step of the way. And if I scroll all the way to the bottom, it has an explainer of all of the filters. And you can access that again from the home page, Contact HCI Support in the bottom right-hand corner, or just by going to the URL, hciclient.com/support, and all these knowledge base articles are free for everyone to take a look at. So it's a great resource for you if you find yourself going to maybe try some of these things yourself in a few days and you need a reminder on some of the steps. You can always go and see if there is a knowledge base article that has those steps available for you, and you can follow along with that. Now it is 2:52, so we're coming up almost on our break. The last thing I want to cover before our break is the user list. So if you don't manage your user list, you can feel free to take your break early. Or if you simply don't have any questions about it as well, that's perfectly fine. So we'll come back at 3:15 regardless. That is 3:15 Eastern. Currently it is 2:52 Eastern. So I'm going to take a look at an example user list. Now, the reason I bring up this user list is because it's not uncommon for during staff changes for user lists to maybe get lost somewhere in the shuffle, become a little out of date, or perhaps you just don't have to manage your user list very often. And now, as you're thinking about new training for the year, you're also thinking about new staff that needs to be added. So you may just be a little bit rusty on how the user list works. The user list is really quite straightforward. All it is a spreadsheet where you keep track of who is in your organization, who within that list needs access to the site, and then you use this to quickly communicate to HCI support whether or not they need to change users on Home Care Institute. Having the user list ensures that support has all the information they need, especially in creation of a new account. Please make sure you know that this sheet is a little bit wide. It's not uncommon for people to fill out these first rows, get to column K, and forget to scroll over, which is a bad thing because columns L and O are required. So just make sure to scroll to the right when you're filling this out. Now, managing the user list shouldn't take you too much time, and it's really not that complicated. Most of it is fairly common sense. Some of the least common sense things are here at the beginning, and this is where we have to think a little bit more like a computer and a little bit less like a person. So computers, great, smart, until they're not. So the computer is always going to look for the top sheet, and it's going to expect it to be named user list, just like this. So you can name your file on your computer whatever you like, but you can't name this sheet anything else. You also can't move this sheet, or else the computer will get confused. So in order to prevent errors, just keep that exactly how it is. If someone else has changed your sheet to be called something else or moved it to a different position, it might be a good idea to change that yourself and save it before you send your next copy to support. Next on our order of thinking like a computer is this first column, column A for action, in which we can enter an N for new user or a C for changed users. The importance of this is that the computer actually skips every line where there's not an entry in column A. This allows it to move quickly through large lists of 200 or 300 plus users. However, it means that even if you have a small list, you do need to remember to put something in column A, or else if I sent this particular file to support, as far as the computer is concerned, I'm not making any changes to any of these users. It's not going to kick back an error. It's not going to notify support that there was an error. It's just going to say, okay, I didn't have anything to do, and I didn't have any problem doing nothing. So if we want the system to make a change, we're going to have to use column A. So in this case, let's pretend all of our users are active. But one of our users is going to leave our organization. This is one of the most common changes that users need to make. So let's pick on John Doe. John Doe was a site administrator. John Doe no longer works with our organization. So he already has an account. We don't need to make him a new account. We just need to change his existing account. So C for change. All that we're changing about him is his status. That is his login status. Can he log in? Yes, A, active. No, I, inactive. If that's the only change I need to make, I can save this and send a copy to support. Now, once he's been inactivated, that is, once I've sent a copy of this to support, if he's no longer a part of my company, I don't have to keep him on my list. I can feel free to delete John Doe. What I don't want to do is say, well, he's not important to my company anymore. He's no longer with us. I'm just going to delete him. The problem here comes back to thinking like a computer. Again, if I just delete John Doe from this list, I haven't told the computer yet to make any changes. As far as the system is concerned, I haven't made any changes to John Doe's account. His account will still exist on Home Care Institute as active and will still count against my active seats. That's why, as soon as somebody leaves your organization, you want to make sure to change their account status to inactive. That way they don't count against your active seats. Only after you inactivate them, that is, after you send this file to support and you hear back from them that your inactivation has been completed, then you can feel free to delete any inactive users. Now let's go through creating a new user. That will allow us to look at the rest of these columns. So in this case, we are creating a new account, not making a change to an existing account. We're probably going to want this person to be able to log on and take training, so they'll be active. And most likely they're going to be a learner. That is, they're just going to go on and take training. They're not going to manage other users, and they're not a site administrator. We're going to want to follow whatever pattern I have for the usernames of all my other users. This should be as specific as possible. You may have a portion of your organization name. In this case, we have HCI, Home Care Institute, Home Care, and then the last name. Let's do Jane this time. You may also have email address. Email address is a very good username. Either way, it just has to be specific to that user. Now, all of these columns that we filled out have an asterisk at the top. That means they are required columns. Email address is not required, but it does allow the user to reset their own password. Any user who has their email attached to their account can have a computer-generated password sent to their account in the event that they forget it. Manager is also not required. As a site administrator, you have the ability to see everyone in your organization, whether or not you're listed as their manager. So somebody always has access to every user. So we can just leave this blank, unless somebody who is listed as a manager needs to be able to see this user. since these people, for example, Beverly Black or Whitney White, can only see people on their team, which is created here by columns H and I. So let's say Jane Doe is on Beverly Black's team. Type this in correctly. There we go. Another important thing to note is if you list somebody as the manager, they need to have an active HCI account and be a manager or site administrator. You cannot list a learner as the manager, and you cannot list a username if there is no account with that username. Now, hire date is also not required. However, the one thing you want to make sure of with the hire date is not to put the user in the future. If our Jane Doe wasn't starting her training until tomorrow, I might think, okay, I'll just make her start date the 18th. And that's fine, except for if I go on later today and try to assign some training to her account so that when she logs on, it's already there, I'm not going to be able to find her. So it's actually better to make the hire date either last week when you agreed to hire her, or today, the day that you add her to the user list. This column K job title is not required. It can be whatever you like. It can be as simple as RN or a little bit longer, like Director of Clinical Services. Your business column L will be the same for every user in your organization. This is the piece that actually puts users in your organization and ensures that you, a site administrator, can see them. You can simply click and drag or copy and paste. This will be in all caps, and it will be an acronym much like this. Level 2 and Level 3 may not be used by all organizations. They're not required. Even if you use it for some users, you're not required to use it for all. And using Level 2 doesn't mean you have to use a Level 3. All these are is a way to subdivide your organization. However, these, just like Level 1, have to have a specific code. And columns L, M, N, and O are all case sensitive and have to be entered exactly correctly or they won't work. They'll cause an error. So all of these N columns are very specific in what they require. If you're not sure what business unit to include here, you can always put the closest thing that you know. And when you send this to support, simply let them know that you weren't sure what the code was for that business unit, and they can correct it for you. More than likely, it'll be all caps, and any spaces will be replaced with an underscore. For the job classification, last but not least, again, it is case sensitive, and it has to come from a specific list. This list is available as a sheet on your user list called Job Classifications. You should only choose codes from this list unless you have already had a conversation with support about a custom code. Custom codes can be created if this list doesn't quite meet your needs. In that case, you just need to contact support. In general, you should be able to use our list. HH will stand for Home Health, HOS will stand for Hospice, ALL is for both Home Health and Hospice disciplines, and we have a few other things such as Private Duty, Pediatric, and even CORP for Corporate. If you're not sure what job classification to give a new user, you can always try looking at what was used for a user with a similar job title. In this case, I see that my RNs are HHRNs. Again, if I'm not sure what to add for this job classification, then I can always ask support. Simply describe it in your email to support when you send your user list, and they can help you find the right job classification. Now that's the basics of the user list. All right, everyone, so we're back for the Q&A section. So I have some of the questions here that people have entered throughout the webinar today. So I want to start with the ones that are related to the user list, which we just talked about. One person asks, where is this spreadsheet, the user list? So the user list is not something that is stored on Home Care Institute. It is not something that you can export easily from Home Care Institute. So hopefully you or someone at your organization has a copy of the user list. If you do not, if you're not able to find it, or I would say if the copy that you have is more than 6 months old, if it hasn't been edited in 6 months, then please contact support. Contact HCI support and just say that you need a new or an updated user list, and we can provide you with one. That way you know you're at least starting fresh. So if you don't have a user list spreadsheet, then just contact support and we can get one for you. Another user list related question is, can we add the staff to Home Care Institute ourselves? That is, add the staff, term them yourself. Yes. So this is always going to be done with the user list. So you can either do it in using the user list as we saw, where you make edits to the user list and send it to support, or you can upload the user list directly yourself. So if you're comfortable with your user list and you want to handle making the changes yourself, then that is something you can do. If you are interested in that, just contact support and we can set up a specific training call where I will go over the user upload tool with you. It is a specific tool. Not everyone has access to it by default, but after I go through the brief training with you, really it's about 20-30 minutes, then I can give you access to the tool, and at that point you'd still use the user list, but you would upload it yourself. Also, we had a question about managers. So on the user list, there's only one row for manager, and it only accepts one manager at a time. So this person asks, can we have multiple managers assigned to one learner? The answer is yes. Now, ideally, if you have people in addition to the direct manager who need to see them, those people would be site administrators, in which case those people would already have access to them. However, if you do have other people who are at the manager level, meaning they only have access to a certain team and you don't want them to have access to the full organization, we can manually add additional managers. However, there still will only be one person listed on your user list. There only can be one person on the user list, and that means you can only update the manager one person at a time. It also means you would be in danger of resetting the manager every time you updated that user. So if that person had a name change, you would have to double check that their managers weren't reset. It is possible. And for most of your learners, most of your users, you're not going to have to change their account very often. So it wouldn't cause an issue in most cases. The easiest way to do it would be not to assign multiple managers to a user, but in fact to put all of those users who share a group of managers into a sub-organization. That is to use the business unit levels, 2 or 3, and make those managers able to manage anyone in that unit. That would be the best way to do it. So it is possible, and there's a couple of different ways we can do it. So if you are needing to have multiple managers for single users, then contact support again, explain your exact situation, and we can work with you to create a custom solution, basically. But it's not going to be just the user list that does it. Okay, so now we have a question about knowledge programs. I'm going to answer this one. Sorry, I touched my mic a little bit there. So the question is, you have an existing knowledge program for 2018, and now the 2019 versions of the courses are out. Will the knowledge program be updated? So the answer is that it should have been. You should have already a 2019 version of your 2018 knowledge programs. Now, if you have not heard anything about your 2019 knowledge programs, and you haven't seen your 2019 knowledge programs, please reach out to support. Please just email support and say, hey, we don't have our 2019 knowledge programs. We just want the 2019 version of what we had in 2018. Or if you do want to make any changes, let us know what those are. But they should have been switched over. If they have not been switched over, then let us know. and we can update them. And our last question is, so if we, the organization, teach a course ourselves, can we track that on Home Care Institute? And will there be a certificate of completion? That is absolutely possible, yes. So if you provide some sort of training, or if your staff takes other external training through some other provider, we can track that on Home Care Institute. So the main way we do that is ILTs. So here's an example sign-up sheet. So all we need to know for external training that someone has done is who took that training, and then we need some of the provider information if it has credit hours assigned to it. If it's not credit hours, if it's just internal training to your company, we can still track it. Just obviously there's not going to be any nursing hours given for it. But if you do have your own ability to provide hours, or if it's through some other provider that has a valid provider number, then we can track that. We can also record a certificate. So if you have a certificate that goes along with this training, we can upload it to the site and have it sort of automatically produce individualized certificates. All we would need would basically be a PDF of what that certificate is, or a scanned copy of a blank certificate, and we could have that stored and printable. So if you do have external training that you want to track on Home Care Institute, again, just contact support and we'll let you know exactly what we need from you, and we'll start that process with you. It's really quite straightforward and not particularly time consuming. We just need sort of a sign-in sheet for any training that you're carrying out, and then any time we're doing new training, we need to know the information about that training so that we can set it up as basically a course without the online portion of it, without the sort of playable course. So yep, those are all things that are possible. If there are no other questions, we can look at some of the things that we didn't quite get around to. I'm going to go back to the site then. I'm still keeping an eye on those questions, so as you think of them, feel free to ask. So one of the things that didn't quite want to cooperate with us earlier was when we were trying to look at that export package course data. So let's see if we can get that to work. There are certain things that always work off of calls and never work on calls. This one usually works though, so let's see what we can do. Let's just pull in completed training. And let's see about exporting the package course data. There we go, it worked this time. So we see it exported a zip file. And again, how these downloads work when you're exporting, whether it's a CSV or it's the package course data, may look a little bit different depending on the browser you're using. You're also going to want to make sure that basically your IT should have Home Care Institute, HCI, ITACIT, all whitelisted. If you have particularly stringent security on your browsers, then you may experience some issues trying to get these reports. So if these reports just don't seem to go anywhere when you hit export, you're probably going to want to get in contact with your internal IT team and make sure that you're allowing these downloads from Home Care Institute. So let's take a look at what this is. So inside of my zip file, I have two. I have interactions and I have launch record. Let's open launch record. Here we see, so these 4 lines are all for the same course. And it's because it was launched multiple times. They all have the same completion date, which is a nonsense completion date. We can see the time spent on each launch. If I go back to the file and go back to the course interactions, instead of just clicking this again, I'm going to get some different data here. Now the course interactions, this is where I can see exactly what somebody answered inside of the course. So this might be particularly helpful if you have some staff who consistently fail or have failed even once if you're concerned about it. If they've failed a test and you're concerned about it, you can go in here and you can see what their answer was versus the correct answer. And then you can always, if you disagree with what that might be, you have, hopefully you'll mostly be using this to take a look at your staff and really support them and see where they might need more help and more guidance. You can also see the exact timestamp for when they were on each of these slides and their overall grade. You can see it even records. So this one looks like it's Understanding Diabetes. It recorded Nancy's name as one of the answers. There was no doubt she was asked to type in her name at the end of that course. Over here on the far right-hand side, we have time taken. So some of my sample data, and these are all sample accounts, so they might not have full data. But you can see the time, this is the time taken on this attempt at this actual question. So this is the time spent on this slide. So you can really get in there and see some of this stuff. All right, looks like we have another question. Managers. Do managers have permission to withdraw a learner from an individual course, or is this done by the site administrator? So site administrators definitely do. On the Transcript Manager here, I could say these are all completed trainings, so I'm not going to want to do that. But I could go instead to Enrolled Training. And this is from the Transcript Manager page, which is a site administrator only page. You can see I can withdraw. However, managers, no, they do not. So if I go to the team training, which is the manager version of that page, and I pull in some training data, my actions here don't include a withdraw. And even if I click on here, I don't have the editable page like the site administrator does. When the site administrator clicks on this, it takes them to a page where they can edit this transcript information. Or it did before. Oh, I just clicked on the same thing. That's why. There we go. So here's the site administrator version. So it is site administrator only to withdraw users from a course. Managers can assign training, but they can't withdraw training or delete training. All right. Another question here. Okay. So this question is, are you able to utilize the instructor-led lead to perform a module as a large group and each gets their contact hours? So this is basically about doing a group training in person where an instructor-led training in person. You absolutely can do that. So that would be the ILTs, the instructor-led training. So in that case, we would just need a sign-in sheet of everyone who is there, clearly printing their name. It'd be excellent if you could send us a spreadsheet with their names already printed and then the sign-in sheet as well with their signatures that they were there. So again, that's just a contacting support, and we can send you a copy of the ILT, which I had pulled up earlier, the ILT sign-in sheet. And absolutely, you can do the instructor-led training where you do, as a group, go through one of our courses. All right, so it looks like that's all the questions there were for right then. Hopefully I didn't accidentally close out somebody's question without answering it. I think I got to everyone. Again, if you have any other questions, feel free to keep putting those to us. Okay. So we did the knowledge programs a bit, did our assignments, some of the reports. That's just about everything I wanted to make sure we cover for this session. I'll stay here and I'll stay available for any questions you might have, especially if you want to go through and try anything on your own. All right, I have another question here. For ILTs, we provide a certificate of completion. Yes, so if training is completed via an ILT and it's marked as completed on Home Care Institute, then whatever certificate is attached to that course will still be available and still be printable. So if they've completed training that's already set up on Home Care Institute with a course, that is one of our training, or with a certificate, I mean, as our training always has certificates, then yes, their certificate will be available. Making sure I'm seeing all of this question here. Yes, so that certificate will still be available if you do the instructor-led training. All right, scrolling through, and I don't see any hands up. You can always put your hand up if you would like to speak aloud and ask your question, or you can continue to put them in the question section of GoToWebinar. So the ILT sheet is not hosted anywhere right now, but what I can do is I can make sure that it will be put in, I think, a sensible place to make sure it is. You can always contact support, of course, and we can give you it. But I can make sure that we create here, tomorrow we can create an ILT article because we don't currently have one. So we'll create an article in the help desk on ILT and we'll store it there as well. So for right now, we don't have it available anywhere. So your best bet is to contact support for a copy of the ILT sheet. But we will go ahead and we'll post it up here too. So it's just not there right now. I invite everyone as well, if you have any specific questions, feel free to ask those during this time. We still have the time, so no harm in using it. There's no question too simple. If you're thinking it, there is almost certainly someone else in the room who is thinking of asking the same question. So feel free to ask anything that you might need to know about Home Care Institute. If you don't have any questions, I can just go through and do some more tips and tricks. So I showed you guys going through the calendars. And I showed you that when we were looking at the export option, so going back in the Transcript Manager here, I'm just pulling in some data. When we exported, I told you could click on value and it would sort this alphabetically. That's actually true everywhere that you see a header. So all these headers that are lighting up blue as I hover over them, I can actually click on any of these and it will sort by that column. And click it a second time to reverse the order. To undo it, I would have to either refresh the page or know which column it was sorting by originally. Most of these pages are sorting by the first column alphabetically to start. Not all. An exception would be if I'm looking at an employee's transcript. So I'm going to the employee profile and I'm looking at the transcript. This one is clearly not sorted alphabetically. It is actually, it's a bit of a complex order. So this one's actually pretty hard to replicate. It's not this as of. It is, here we can kind of see some dates, and it's these dates on the left, which you can't actually get at. We can sort by the as of or by the status. Those are two common ones that I use. So I might sort by completed as of, starting and most recent is going to be the second time you click it. The first time you click it, it's starting with older information there. This is also a site administrator page. You notice in here we have the new create transcripts again. This one, when we go in here, it is automatically having the user we were looking at selected, but we could still add more users. So this is basically the same as the Transcript Manager new transcript page. We also have the edit and delete buttons here. Again, very powerful. Here under actions, all we have is row count and export. So we can actually export a single user's transcript history from their transcript here. However, sorting by this, we're going to see we don't have the credits here. So if you have, for example, you have a auditor on site and they want to see those credit hours, you're going to want to use the Transcript Manager. Credit hours are also on certificates, so any completed training, the certificates are going to show that as well. So if you have the certificates on file, that should hopefully satisfy their questions. The provider number is also on all of our certificates. I'm going to go back to the home page. Again, keep the questions coming if you have any. I'm going to show you now. So if I click on my own name, that is my test name here. Every user has access to this page. This is their own training profile. So they can launch courses directly from here. It's just an alternative to using the dashboard. They can also manage their profile. So they can actually upload an avatar, which might be more so for you since you probably spend a little more time on here than anyone else. If you want to, you can always upload an avatar. Do recommend it's no more than 512 by 512 pixels, so pretty small file. The PNG or a JPEG is more so a suggestion, but it's a good suggestion. We don't usually store the address and it's not required, but if for some reason you wanted to track it, you could track it inside of Home Care Institute. Now on the right-hand side, I do want to point out notification delivery methods. So by default, Home Care Institute focuses on email, since we have the email on our user list spreadsheet. However, users can also opt to be notified by text message. If they opt to be notified by text message, they'll need to provide their mobile phone number. So this is great. Oh, I can't believe that just showed. If they have a work phone, for example, they can get messages straight to there. It's also great because that includes our built-in messaging system. So when you send a message on the site, on the platform, you can choose to send it also via email. And if the user you are sending it to has text messages enabled too, it will also send them a text message, just letting them know that they have something on their messages waiting for them. Users can also in here edit their email address. So here on the left-hand side. However, if a user edits their email here and then you update their account using the user list will overwrite that. So the user list does take priority over everything that's done manually on the site. Which takes me back. I want to go back to the employee page. And I want to go ahead and just point out, so on this employee search page, it's a great page. I love it. You notice we have some new edit and delete buttons. We never want to use these. Never, ever, ever. The only reason they're here is because we do want you to have the action button. We do want you to be able to send messages, row count, export from this page. So you can create a list. It's not the same as the user list, but you can create a list of who is on Home Care Institute exporting from here. So this is actually a great place if you're not sure how many people you have active, if you're not sure if your user list might be out of date. You can always get your first name, last name. Probably a good idea to include active. Yep. So we've got whether or not everybody's active. Just get the first name, last name. And I can export that as a list. So I know exactly who is and is not active on Home Care Institute. So that's always available for you to check. So because we want you to have that action button, we also have those new edit delete buttons, but you really, really shouldn't use them. They are far more complex than they seem to be, so they can create a lot of problems. Whereas the user list, it's quite difficult using the user list to create too much mess on Home Care Institute. Using the user list, the only problems you can really create for yourself are if, as we discussed, you delete a user without inactivating them, in which case they're still going to count against your active seats, or if you mistakenly add a new user instead of changing someone's name. So if, let's pick on Moniette. Moniette has a name change. What I mean to do is change her account. And maybe she has a last name. She's going to be Thompson now. And maybe to match that, I want to change her username. This is totally fine. Except for when I send this to support, I want to make sure that they know I'm changing an existing user. Because the computer, again, in its infinite wisdom, is not quite wise enough for this. The computer is going to say, I don't have a user with the username HCI M Thompson. And it's not going to suggest M Cho. It's just going to say, I don't know who this is. Now, in a case of a small organization like this, where there's one Moniette, support might know what you're trying to do. And they might email you back just to double check, but they're probably going to be able to figure it out. But if it's a more common name, or if you just have a larger staff, support really isn't going to know. They're going to get this error that this account doesn't exist, and they might even say, well, maybe I just create the account for now, and I ask them if that was what they wanted. And if you don't see that email, or you don't reply, then support says, okay, well, I guess they did want the new account. And now you have a new account. So what you want to do is if you have a name change, change it, but let us know. Just let us know that you've changed that user. Sometimes we also do have people just accidentally add that person as a new user. They may also have a typo. So in this case, that was an intentional change. But let's say I've entered this user in wrong. Say, oh no, it's not Alvarez. That's not their name, so I'm just going to delete this, and I'm going to re-enter them. Well, this creates a problem, right? Because it's the same thing as if we accidentally don't inactivate somebody. We don't want to just add a new Danielle with her name corrected, because now Danielle has two accounts. So just always be careful of that, that you're not accidentally creating a new account for somebody who technically can log on right now. If somebody has the ability to log on, then you want to make sure that whatever change you're making, it's to the existing account. All right, still keeping my eyes open if you do come up with any more questions you might have. Anything you're not sure how to do or you're not sure if you're able to do on Home Care Institute, make excellent questions for this time. Another capability on Home Care Institute, we've talked a little bit about recording those in-person sessions, those instructor-led trainings. If you are one of our larger clients, that is, you'll know that if you're one of these larger clients because when you log on to Home Care Institute, you don't have this banner. You have a custom banner. That's something that we're only able to provide, unfortunately, for clients above a certain number. So if that's you, we also have the ability to, since you're a larger client and you're organized a little bit differently on the site, we have the ability to host some custom training for you. So that means we can create a course based on a PDF or a video or a series of questions you might have, which you can put inside of a PowerPoint. We convert that into a course and it becomes something you can link to, assign, track on Home Care Institute. So if you are one of our custom setup clients and you would like to maybe put some of your own training on Home Care Institute, you certainly can. Even if it's something as simple as tracking who has and hasn't read the employee handbook. Today we went over reports. The reports hopefully won't take too much time, and as you get used to them, they do become faster and faster to do. However, we understand that sometimes it's just time consuming and you have a lot on your plate. Never hesitate to ask us to run a report for you. This includes if you know you're going to need a report ahead of time. So if you know that you need a certain report on a certain date, even repeated, you can ask support to keep track of that for you. We're perfectly happy to do that. Since unfortunately that's not a feature we're able to offer via the site, that's something that we have manpower to do. Where the site fails, manpower is always available. So if you need any help with reports, even a recurring report, don't feel shy about asking support. If you see a few things on this test account that you may not see on your own homepage, don't be alarmed. She's got some of the beta features here. Here under my drop-down menu, you see also under my employees, I have the employee uploads tool. So if you are interested in uploading your own user list, that's where the tool will be visible for those who have been given access to it. Right now, you more than likely do not have that tool there. Under employees here, so we've looked quite a bit at the employee page. I like to use that when I'm troubleshooting transcript issues or really any issue that a single employee is reporting having. But system access is a very useful tool. This is where you can easily reset passwords. So you would simply look for the user, select the one who needs the reset, and you can assign a temporary password. This assign a temporary password allows you to either generate a random password, which you can send to them via an email, or you can select the password. This is particularly good for clients who may not have immediate access to their email, so we can simply give something that's easy to communicate. For example, support always resets password as password, lowercase. You could use the name of your organization. Or you could use a simple noun. You might want to go for something a little bit shorter. That works too. And you can either send it via a notification, which will go to their email, or you can export it as a CSV file, in which case you could print it out and hand it to the employee. You'll notice that one of our options under Action was also Unlock Account. So it is possible for users to lock themselves out of their account by too many incorrect password attempts. It's quite a large number, but it happens. So if you're ever looking for a user who's complaining that they can't log in and they don't show up when you search for them, it's probably because their account is locked. If we scroll down, we notice it says Account Locked No. So if you search for someone and they don't show up, try switching it to Yes. Then they should appear. In that case, we would simply check them off, unlock their account, and then reset their password. There's really no reason to ever lock the account, but technically, you do have the option. Since we've talked about it some, I want to just take a brief look at the My Message system. This is, again, something that would allow us to send messages, which could also send a message via email. And although the text option doesn't show up here, if the user has opted into getting text messages, it will also send a text message notification that they have a new message. Our ad recipients should look very familiar. This is a search window we've seen a lot by now. An important option here is to hide all recipients from each other. This way, if we're contacting our staff, say about incomplete training, as far as they know, they're the only one who has gotten this message, and they don't get a full list of everyone else who has incomplete training. We can also include attachments and put a read receipt. Personally, read receipts drive me insane, but the option is there. And we have some basic formatting options: bold, italic, underline, and text color. On the left-hand side, we can quickly jump between things such as received versus sent, even things that say they need to be acted on. All right, well, we're about to wrap things up. For our last thing that we're covering today, I just want to point out that we do have a mobile app. The mobile app is free. It might look a little bit different than you're expecting because it looks quite different from our site. You can get it on any app store. So here is a link to Google Play, but it is also available for Apple products. So it's available for iOS. You just look for iTacit Mobile. Anyone can use this, so it's not just for site administrators, it's for any users, and really it's meant for taking training. It does have the message system built in, but it doesn't have any reporting. So it's really for logging on and taking training. And these screenshots are basically what it looks like. It's a clean, simple app. In order for a user to log on to the app and take training on it, they do have to have logged on at least one time and set their password on the browser version of the site, and then they can start using the application, the mobile app. Well, it looks like we don't have any more questions. If you think of anything after this call, please feel free to send those messages either via the ticket system or via email to our support team. Email is, of course, support@homecareinstitute.com. And our ticket system is, as we've seen before, available from the home page or by URL hciclient.com/support. And let us know if you have any trouble doing any of the things we've covered today, or if you have any questions. Thank you, everyone, for joining us, and we hope you have a great rest of the week and weekend.